Once you've done your initial dividing by making people walk from one area to another, you go to the people who are still left down. How do you decide what's wrong with them? Well, we use two ways of assessing them. One is called the primary survey. Any of you who have taken CPR probably heard this before, the ABCs. Does anyone know what that stands for? Go ahead. Airway, breathing, and circulation, right. You know, you can do wonderful chest compressions or put a pressure dressing on someone and stop the bleeding, but if they're not breathing, it doesn't do any good. Okay, that's the first thing that you have to take care of is the airway. Make sure it's open and patent and that they're exchanging air. The first thing you do when you get to someone and you're assessing the airway is to open the airway. Look, listen, and feel, okay? You look to see if their chest is rising. You put your ear down by their mouth to see if you can hear the air coming in and out. And you can put your hand on their belly to see if the abdomen is rising. Some people breathe from their abdomen rather than their chest, and you'll feel the rise and fall of the abdomen. If you don't hear or see any signs of breathing, you need to try and open the airway. And you can do that with a chin lift or a jaw thrust. Put your hand on someone's forehead and on their chin and just lift.
So I lift the chin, I take the head back as far as I can. Look at that, roll. It is a significant distance. For an adult, open the airway as far as you can. There is no maximum. The trouble is people don't go to the maximum, don't quite be successful.
In a child, there's not so much of a tip as there is what we call a sniffing position, where you bring them a little bit forward. Again, you can do that with the chin lift. Now, abnormal respiratory rates, okay? In an adult, anything over 20 is considered abnormal. Now, a lot of people will start breathing faster when they're stressed. Most all of us do. Your heart rate goes up too. But that usually stops after a short period of time. But if it continues, a rate over 20 is considered abnormal, and you should look for other signs of injuries to see what's causing that. In a teenager, an adolescent, also over 20. In a school-age child, anything over 25 would be abnormal. They breathe a little faster, usually. Toddler can go up to 30 and still be considered normal, and an infant up to 40 times a minute is normal for an infant. Now, what are symptoms of breathing problems? The rate is very fast or very slow, okay? Noisy or labored. A noisy airway is an obstructed airway. That's something that we say all the time in the emergency room. A change in skin color is also a sign of respiratory problems. You'll see paleness at first. A late sign is what we call cyanosis. People get a little blue and then purple, usually in their fingertips, their ears, their lips. That's where you see it. In a person of color, you can look at the mucous membranes, pull down the eye or open the mouth, and you'll see paleness or the blue color. Also, a deformity in the chest would be an indication to you that someone might be having breathing problems. When you look to see the chest rise, if only one side is going up and down, the other isn't, they probably have a collapsed lung. Okay, so that's airway and breathing. And we go to circulation. When you're assessing the circulation, what you're assessing for is shock. And shock can be caused usually by excessive bleeding. And sometimes it's not always visible. It can be internal. The way to assess for this is, one, to check pulses. Anyone know where you check for pulses? Right, the carotid is the easiest. It's also the closest to the heart. So you usually will feel a carotid pulse when you can't feel pulses in other areas. It's in the groove of muscles on your neck. Can everyone feel theirs? Don't press too hard. You can occlude it and then you won't feel it. And if you use your thumb, you'll feel your own pulse. So use your fingers, maybe 3 fingers. Another place is over the radial artery, which is by the thumb, okay? And again, don't press too hard or you'll occlude the artery and you won't feel the pulse. You also check capillary refill. And you do that, everyone can press your nail bed. You'll see it turns white or blanches, and then when you let go, it pinks up again, okay? It should happen within 2 to 3 seconds. That's normal. If it's longer than that, the circulation is compromised. Now in smokers, it often takes longer because their circulation is compromised from the chronic smoking. And the level of consciousness is another way to assess for shock. If someone is not totally alert, it's because blood is not getting to their brain. And so a sign of compromised circulation would be a lower level of consciousness, someone who's confused or unconscious, all the way up to unconscious. Now after you've done the ABCs, and you know that they're breathing and that they have a pulse, then you need to do a secondary survey, what we call secondary survey. That's the head to toe, and that's how you do it. You start at the head and you work down to the toe.